The project concept that we have in Oyo State, in Nigeria, is trying to find a way to address the issue of maternal and child health and some of the challenges that women can come across during pregnancy. Specifically, it addresses the issue of maternal depression.
Perinatal depression is a common problem among women, both in pregnancy and after childbirth.
And so the goal of this project was to improve the identification of women who were suffering from these kinds of mental health problems during pregnancy, and also to implement psychosocial intervention for these women using healthcare professionals.
The main objective was to bring mental health care at the primary healthcare level and to make it accessible to pregnant women.
In Nigeria, you have about 250 psychiatrists to more than 200 million people. So how are you going to be able to have a training for primary care providers that depend on psychiatrists when there are so few? So the idea is to try and see how can we get non-specialists to also become trainers.
One of the key innovative elements was, in fact, implementing a brief screening program that could be implemented in primary care, using non-mental health specialists to both screen and deliver the intervention that we designed. We have been able to begin to implement this 2-item screening measure, which really permits identification, because prior to the inception of this project, we know identification of cases was very infrequent.
The impact of having such women identified and treated in the places where they receive antenatal care is really very big, because that's where they go when they are pregnant, when they want to have antenatal care. And so if those providers of that care can detect their depression and can then relieve them from the disability associated with this depression, and can also ensure that they then are able to provide and care for their infants, because we know that perinatal depression has very terrible consequences on their infants.
The rate of diagnosis of maternal depression at the PhD level has increased tremendously. And with that increase and the approach to manage it, it has resulted in a good outcome of the maternal health and child health.
The project's been innovative in several ways, the main one being that it's been able to bring mental health care to pregnant women in a sustainable way. It has already become part of the policy at the regional level, and it's going to be a part of the policy at the national level, where at the primary healthcare level, so at the first point of contact between pregnant women and their healthcare providers, the Nigerian policy now includes mental health care for pregnant women.
This project has been able to expose the healthcare provider to go a step further in managing such women, help them to keep a home, and help to save the future of those children.